Concierge care. Sounds pretty unique, right? Well, let's find out more with our next guest, CEO of Able Medical Group, Pete Jensen. Pete, thank you very much for being here today,
Great to be here. Thanks for having me.
All right, so what inspired the creation of Able Medical Group, and how is it different from a traditional doctor's office?
Yeah, so Able Medical, we founded it on two basic challenges that you see in traditional medicine.
Okay.
The first being time with your physician. As you've gone through the ages and insurance-based care, you find that you really don't get time with your doctor anymore. You get 10 minutes here, 15 minutes there.
Right.
When you're sick, you're not feeling good, you go in, but you don't get much more than that. And so the idea with the creation of Able was to give doctors and patients back that relationship.
I like that.
That time to spend with each other. Our intakes are about an hour. That gives doctors time to dig into those biomarkers, go through that family history, really understand a patient completely and give them value. The second piece of that is the preventative side. Most people are really affected nowadays by heart disease, metabolic disease, diabetes, those types of things. And the risk factors for those things kick in years before they're diagnosed often. And so at Able, we look at those risk factors early on and work with our patients over time to help prevent or limit the risk toward those things.
I think that's fantastic. The whole idea of preventing those diseases or conditions is just amazing, right?
100%,
Like, I mean,
yeah.
folks don't want to have to go experience that, right?
Yeah.
If we can figure out a way to prevent that, that's amazing. Okay, so tell us about how Able integrates fitness, nutrition, and lifestyle into its medical care, and how does that work in practice?
Yeah, and so you think back to those conditions, things like heart disease, cancer, metabolic disease, diabetes, those types of things. Those are very much lifestyle dependent, right? There's a lot of changes you can make in your lifestyle to very much lower your risk of those conditions. And so when we were building the practice, our physicians all came to the same place. If we're not working with patients nutritionally, giving them advice on physical exercise and movement patterns, managing sleep and stress, there's nothing we can do just pharmaceutically to really correct those issues as we can when we look at lifestyle. So our doctors look at the 360 view of the patient, to look at everything from the family history down through all the risk factors they have for those conditions, and then recommend nutritional changes, exercise and movement pattern changes, stress management, sleep management, to really give our patients the best chance to lower those risks of encountering those diseases.
I dig it. Wow, this is very cool. I like this. This sounds great. So why launch this model in Northeast Florida? And why now?
Yeah, I mean, ultimately now people are becoming more aware of their health, and frankly, more of these conditions are becoming more prolific, right? How many of us have a father, mother, aunt, uncle who have run into one of these problems, right? And so as we all get older and we're all being more mindful of our health, we saw an opportunity to provide a product and a service where doctors get to connect with patients, build relationships with patients again like they used to, and then really help patients understand what they can do to really maximize their risk reduction.
Okay, so, you know, with open enrollment happening right now, how does concierge medicine fit into people's healthcare planning?
Yeah, you know, we like to present the idea of let insurance be what insurance is meant to be. It's there to mitigate your risk of a catastrophic condition. But when you look at day-to-day healthcare, there's lots of options to change your insurance plan just for those catastrophic conditions, and then you can pay out of pocket for the right fit, the right doctor for you. And that's what we recommend, is look at the insurance option and then concierge private pay as a hybrid, where you have insurance to cover the catastrophic, and then you can really pick your doctor and find doctors that can spend much more time with you when you pay them directly.
Gotcha. Man, thank you very much for coming here. This sounds
Pleasure.
fantastic. Guys, the information is right there on your screen. Make sure that you reach out to them. But for now,